Laparoscopic room-wide gastric bypass and laparoscopic sleeve gastrectomy, part 2, how do the procedures work? I'm sure you're all familiar with diagrams of the two procedures. So in the sleeve gastrectomy, we form a narrow tube from the stomach approximately a centimetre in diameter. This reduces the stomach's capacity to a volume of about 40 to 50 mils of food, probably reducing its total capacity by about 80 to 90%. In the room-wide gastric bypass, we form a small pouch from the upper stomach that's approximately 20 to 30 mils in volume, again dramatically reducing the capacity of the stomach. So it's fairly obvious that the first way these procedures work is really by restriction, reducing portion sizes so that the patients eat very much less than they used to. But the second way these procedures work is really through appetite control. And I think for most people, dieting really doesn't work because of appetite. When you eat less, your body thinks it's starving to death, so it upregulates your appetite, makes you go looking for food, and this is why dieting mostly doesn't work. So both of these procedures will control your appetite, but in different ways. In the sleeve gastrectomy, we remove the upper part of the stomach called the fundus, and within the fundus there are cells that produce a hormone called ghrelin that's a key part of appetite control. By removing this part of the stomach, we remove those cells, reduce the ghrelin levels so the patients are much less hungry, much less interested in food. The bypass does it differently. After the procedure, exactly as the name suggests, food no longer goes through the stomach and first part of the small bowel. It bypasses those parts of the intestine. And this really interferes with gut hormones that control both appetite and sugar control. We know that after the room-wide gastric bypass, patients can be non-diabetic immediately after surgery before they've really lost any weight. And this same mechanism is part of appetite control. So the patients after the room-wide gastric bypass are much less hungry, much less interested in food. And I can see ladies in clinic who no longer feel hungry, almost have to remind themselves to eat. The third way that the room-wide gastric bypass works that is different to the sleeve gastrectomy is this side effect called dumping, where if you eat high fat content foods or high sugar content foods, you get this group of symptoms that are really very unpleasant: anxiety, nausea, abdominal cramps, often diarrhea, then overwhelming drowsiness. The patient sleeps it off and then they feel very much better. And that can be a very useful deterrent for patients who really cannot avoid eating sugars in the form of sweets, chocolate, cakes, biscuits. And you really won't see that effect with the sleeve gastrectomy. So if you eat sugars with the sleeve gastrectomy, those calories probably will be absorbed. So in summary, the procedures work in two ways. They physically restrict how much you can eat, they control appetite, and the laparoscopic room-wide gastric bypass has this side effect called dumping.